for LIFE YouTube, PPPVVB. Sex education for LIFE YouTube, PPPVVB. Female reproductive system consists of organs in the female body that are involved in producing offspring. External female reproductive organs: vulva, mons veneris, labia majora, labia minora, clitoris. Hymen, female reproduction. Mons veneris, the fatty tissue that covers the front of the pubic bone and serves as protection for internal reproductive organs. Labia majora, heavy folds of skin that surround the opening of the vagina. External female reproductive organs. Labia minora, two smaller folds of skin located within the labia majora. The clitoris and the opening of the urethra and the vagina are located within the labia minora. Clitoris, small, highly sensitive structure located above the opening of the urethra. Richly supplied with blood vessels and nerve endings. Hymen, a thin membrane that stretches across the opening of the vagina. Internal female reproductive organs. Ovaries. Fallopian tubes. Uterus. Vagina. Internal female reproductive organs. Ovaries, female reproductive glands that produce ova and estrogen. Females born with between 200,000 and 400,000 immature ova in the ovaries. About 375 of these ova will mature and be released in a female's lifetime. Ova begin to develop during puberty, each contained in follicle. Ova matured and released every month from its follicle during the menstrual cycle. Ovulation, the release of a mature ovum from one of the ovaries. Internal female reproductive organs. When an ovum is released from an ovary, it enters one of the fallopian tubes. Fallopian tube, a tube 4 inches long that connects an ovary to the uterus. Females have 2 fallopian tubes, one connected to each ovary. A mature ovum moves through a fallopian tube to the uterus during the menstrual cycle. Fertilization occurs in the fallopian tubes. An ovum that is not fertilized disintegrates in the uterus or leaves the body during menstrual flow. Uterus, muscular organ that receives and supports the fertilized egg during pregnancy and contracts during childbirth to help with delivery. Internal female reproductive organs. Cervix, the lowest part of the uterus and connects the uterus to the vagina. Vagina, muscular tube that connects the uterus to the outside of the body. The vagina serves as the female organ for sexual intercourse. The birth canal. The passageway for the menstrual flow cycle. Male reproduction. Puberty, the stage of growth and development when the body becomes capable of producing offspring. Male's pituitary gland increases its production of LH, hormone that travels through bloodstream to testes, causing it to secrete testosterone. Testosterone, hormone that produces male secondary sex characteristics. Physical and emotional changes that occur during puberty, ages 12 to 15. Male reproductive system. Male reproductive system consists of organs in the male body that are involved in producing offspring. External organs. Penis, male sex organ used for reproduction and urination. Scrotum, a sac-like pouch that holds the testes and helps regulate their temperature. Hangs lower than the body so sperm can be produced. Testes, male reproductive glands that produce sperm cells and testosterone. Sperm, male reproductive cells. Male reproduction system. Internal male reproductive organs. Testes. Seminiferous tubules. Epididymis. Vas deferens. Seminal vesicles. Ejaculatory duct. Prostate gland. Cooper's glands. Urethra. Sperm production. Seminiferous tubules, network of coiled tubules in which sperm are produced. Spermatogenesis, process by which sperm are produced. After sperm are produced in the seminiferous tubules, they move to the epididymis. Epididymis, comma-shaped structure along the upper rear surface of the testes where sperm mature. Some sperm are stored here. Most move to the vas deferens after they mature. Male reproduction system. Vas deferens, two long, thin tubes that act as a passageway for sperm and a place for sperm storage. Extend from the epididymis and the scrotum up into the abdomen. The walls are lined with cilia, which help transport sperm when the walls are contracting. Form part of the ejaculatory duct with the seminal vesicles. Male reproduction. Seminal vesicles, two small glands that secrete a fluid rich in sugar that nourishes sperm and helps them move. Ejaculatory duct, short, straight tube that passes into the prostate gland and opens into the urethra. Urethra, serves as a passageway for sperm and urine to leave the body. Male reproduction. Prostate gland, a gland that produces a fluid that helps keep sperm alive. Located beneath the bladder and surrounds the urethra. Necessary for fertilization to keep sperm alive. Cooper's glands, located beneath the prostate gland. Two small glands that secrete a clear, lubrication fluid into the urethra. Male reproduction. Erection, process that occurs when the penis swells with blood and elongates. May be accompanied by an ejaculation. Ejaculation, the passage of semen from the penis and is a result of a series of muscular contractions. Semen, the fluid that contains the sperm and fluids from the seminal vesicles, prostate gland, and Cooper's glands. Male reproductive health. Circumcision, the surgical removal of the foreskin from the penis. Foreskin, skin covering the end of the penis. Usually performed on the second day after birth. May reduce the risk of urinary infections and cancer of the penis. Smegma, substance that forms under the foreskin consisting of dead skin and other fluids. Inguinal hernia. The testes pass from the abdomen into the scrotum through the inguinal canal during the 7th month of pregnancy, which then closes. Inguinal hernia, a hernia in which some of the intestine pushes through the inguinal canal into the scrotum. Can be painful, can be repaired surgically.